Welcome to Pipeline Health's educational series, Paragon Basics for Nursing, Clinical Care Station Icon Basics.
On the far left, you might see the red icons. That red icon is patient alert. So patient alert provides important specific information that you may need to know. For example, if the patient is on isolation, right, you have the ability to enter these patient alerts, right? So anyone who has access to the system can view the patient alerts. And the nurses are the ones entering, right, patient alert. So again, it's always good to see what that patient alert is, right? So you are aware. If you need to add a patient alert, you may add a patient alert by highlighting the patient, right, the encounter. And on the primary toolbar, top right-hand side, we have patient alerts. So then you click on the drop down and then you select the appropriate alert. So let's say, for example, your patient 101 has a combative behavior. Select combative behavior. You have the ability to add an alert comment. So let's say this patient likes to spit and kick. The start date will be the date that was entered. Depending on the type of alert, if there's an end date, right, you may enter that information. And level, you have two options, person or visit. What is the difference between those two? If you select person, that means that patient alert will be available for subsequent visits. If you select visit, once the patient gets discharged, that patient alert will also fall off with that encounter number. So you use your nursing judgment and you select what's appropriate. In this case, I would select visit, as it doesn't necessarily mean that the patient will be combative the next time or if they ever come back to the facility. You can add multiple alerts, right, by clicking on the paper icon, and you may also delete the alert by clicking on the eraser icon. Then it's followed by the yellow icon. So you might see some of the sticky notes. Sticky notes, nurses use this as an FYI, nurse-to-nurse communication, reminders. Just FYI, patient alerts and sticky notes are not part of the patient's legal medical record. So sometimes we have family members who leave their phone number, so that's something you may add here. You can also enter multiple sticky notes, and you may delete your own sticky notes. Then it's followed by the IB icon. So this is, as you can see, it says infusion documentation incomplete. So whenever you document an administration, right, for IVs, that will trigger this icon or this message, right? So you are required to enter the end date and time of when that bottle or bag finishes, right? So once you enter the date and time, that icon will fall off care glance. So as you can see, patient 107 and 108 did not have the IV icon anymore. And shortcuts, right? So you may access the shortcuts, or you may access these shortcuts by also clicking on the module located on the primary toolbar or secondary toolbar. So throughout the training, you will hear me say primary or secondary toolbar. On the secondary toolbar, we have a legend. It lets you know here what these colors indicate and also the shortcuts, right? The bubbles. We refer to them as bubbles. So we have AA that stands for admission assessment. So if it's in red, that indicates the admission assessment has not been started. So a new admission, right? When you get a new admission, you will see most of those icons in red or white, indicating there's no data in there. Yellow, it indicates it's in process. Green, it's complete. Very similar to the care plan, followed by CP, right? So that's the care plan. Red, it hasn't been started. Yellow, it's pending initiation. Green, it means it's been initiated. If you ever discharge a patient without completing a care plan, you will see the exclamation mark. And a check mark means the care plan is complete. We do not use interventions, so we are going to skip the interventions. Then it's followed by the RX. So RX is med admin. Right? You may access the med admin by double clicking on the RX, or you may double click on the med admin located on the primary toolbar. Then it's followed by FS, which stands for flow sheet. In the flow sheet, this is where you're going to enter patients' vital signs. Then it's followed by the NR. So the NR stands for new results. This is where you're going to go to view all results. And every time you receive a new result, it will change colors. So red indicates it's a new abnormal result, and green indicates it's a new normal result. And if it's white, that means there are no new results. However, you may access or open NR at any time to view any previous lab results and radiology results. So I already mentioned those other icons, right? Patient alert, sticky note, IV. Then it's followed by the MR. So MR stands for medication reconciliation. At pipeline facilities, only the physicians, right, and mid-levels have the ability to perform a MedRec, admission, transfer, or discharge MedRec. And all the providers are also aware that that is their responsibility. I would just suggest reminding the doctor, hey doc, you have an admission MedRec to complete, or don't forget to complete the discharge MedRec, and they'll do it. However, the nurse is responsible of updating patients' home medications. Then it's followed by the doc column, so that stands for medical record documentation. Under that doc column, you will only be able to view the electronic FISDoc, right? And that is the progress note, consultation notes. ED uses electronic FISDoc, so you'll see all of the ED doctor's notes, HNPs. And then the last three columns are order work queues. So we have the acknowledge queue. So I'm starting from right to left. The acknowledge queue, every time you have a new order, whether it was entered by the physician or let's say you enter orders, telephone orders, you will be required to acknowledge all these new orders. Then it's followed by the RX work queue. So RX work queue, every time there is a new medication order, that order will go into the RX work queue. The pharmacist is the one responsible of processing those medication orders. So even if you try to click on it, you will not be able to open it. But once you see it turns white, that means the pharmacist already processed it, and you will see the medications in the MAR. Then it's followed by the OM work queue, which stands for Order Manager Work Queue, also known as the nurse's work queue. So anything that sits in the OM work queue requires the nurse's attention. For example, lab orders that require the specimen collection, cultures, diet orders go through the nurse's work queue first. And then once you process those orders, the lab will receive it. If it's a diet order, then the dietitian or dietary will receive it. And another order you're going to see in there is consult.